Welcome. Have you ever experienced persistent congestion, a runny nose, or frequent sneezing, but allergy tests come back negative? You might be experiencing non-allergic rhinitis. In this video, we'll delve into this often misunderstood condition, exploring its causes, symptoms, diagnosis, and management. Let's get started. The exact cause of non-allergic rhinitis remains a bit of a mystery. Unlike allergic rhinitis, it's not triggered by allergens like pollen or pet dander. However, several factors are believed to play a role. These include irritants such as smoke, strong odors, changes in weather, certain medications, hormonal changes, and even stress. Some people experience symptoms triggered by spicy foods or alcohol. Essentially, anything that irritates the nasal passages can potentially trigger non-allergic rhinitis. While the precise mechanisms are still being investigated, it's thought that non-allergic rhinitis involves an overreactive nasal lining. This overreactivity leads to inflammation and increased mucus production in response to non-allergic triggers. The triggers stimulate nerve endings in the nasal passages, leading to a cascade of events that result in the characteristic symptoms of a runny nose, congestion, and sneezing. This inflammatory response, unlike allergic rhinitis, doesn't involve the immune system antibody Ig. The blood vessels within the nasal lining also dilate, contributing to nasal congestion. Determining the exact prevalence of non-allergic rhinitis is challenging because many people may self-treat or not seek medical attention. However, studies suggest that it affects a significant portion of the population, potentially up to 30%. It can occur at any age, but it's more commonly diagnosed in adults. Interestingly, it seems to affect women slightly more often than men, possibly due to hormonal influences. The symptoms of non-allergic rhinitis can be quite similar to those of allergic rhinitis, which can sometimes make diagnosis tricky. Common symptoms include a runny nose, nasal congestion, sneezing, and postnasal drip. However, unlike allergic rhinitis, non-allergic rhinitis typically does not involve itchy eyes, nose, or throat. Some people might also experience a reduced sense of smell. Symptoms can be persistent or intermittent, varying in severity depending on the triggering factors. Diagnosing non-allergic rhinitis typically involves a process of elimination. First, your doctor will take a detailed medical history and perform a physical exam. Allergy testing, such as skin prick tests or blood tests, will be conducted to rule out allergic rhinitis. If allergy tests are negative and your symptoms align with those of rhinitis, non-allergic rhinitis is the likely diagnosis. In some cases, a nasal endoscopy may be performed to visualize the nasal passages and rule out other possible causes, such as nasal polyps. While there aren't strict classifications or types in the same way as with some other diseases, non-allergic rhinitis is sometimes categorized based on prominent triggers or associated conditions. For example, some people experience gustatory rhinitis, triggered specifically by eating. Others may have vasomotor rhinitis, where changes in temperature or humidity are the primary trigger. Furthermore, non-allergic rhinitis can be coexistent with other conditions, such as atrophic rhinitis and rhinitis medicamentosa. Treatment for non-allergic rhinitis focuses on managing symptoms and avoiding triggers. There's no cure, but there are several effective strategies. Nasal saline rinses can help to clear nasal passages and reduce irritation. Decongestant nasal sprays can provide temporary relief from congestion, but they should be used cautiously and only for a short period due to the risk of rebound congestion. Corticosteroid nasal sprays can help reduce inflammation in the nasal passages. Antihistamine nasal sprays, although primarily used for allergies, can sometimes help reduce symptoms in some people with non-allergic rhinitis. In severe cases, oral medications or even surgical options might be considered. Identifying and avoiding triggers is also essential to keep your symptoms at bay. While completely preventing non-allergic rhinitis isn't always possible, minimizing exposure to known irritants can help reduce the frequency and severity of symptoms. This might involve avoiding smoke, strong odors, or specific foods that trigger your symptoms. Using a humidifier to maintain moisture in the air, especially during dry seasons, can also be beneficial. Managing stress and practicing good hygiene can also contribute to overall nasal health. The prognosis for non-allergic rhinitis is generally good. While the condition can be chronic and bothersome, it's not life-threatening. With appropriate management and avoidance of triggers, most people can effectively control their symptoms and maintain a good quality of life. Recent research is focusing on understanding the specific mechanisms involved in the development of non-allergic rhinitis, which may lead to more targeted and effective treatments in the future. Studies are also exploring the potential role of neuropeptides and other inflammatory mediators in the nasal lining.